So the number one complication of having a baby is postpartum depression and anxiety. It's the leading complication, and it impacts up to 1 in 5 women every year. Hello, my name is Maureen, and I am the CEO and founder of Mammha. This photo was taken 15 years ago, right after my first OB exam. And I told the doctor that I didn't feel like myself. I was sad. Without missing a beat, she said, "You should be happy. You're having a baby." And just like that, I was ushered out of the office with no help and no support. My thoughts quickly progressed, and I had a plan to take my life after my son was born. I was convinced he deserved something better than me. I would go on and tell 29 care providers something was wrong, but they didn't know what to do with me and they didn't know what this was. It would take 190 days for me to find the right help. I thought I could have been just unique, so I picked up a video camera and made the first documentary film exposing the gaps in care in the US with maternal mental health. And I learned that the care that I received is actually the standard of care. There is no standard of care. So I spearheaded the first national awareness campaigns and lobbied Congress for funding, but it just wasn't enough. So the number one complication of having a baby is postpartum depression and anxiety. It's the leading complication, and it impacts up to 1 in 5 women every year. So chances are that someone listening right now knows somebody who experienced this. Now, despite the high prevalence, less than 20% of our physicians are actually screening, and 75% of women don't get treatment at all. So only 15%. This is a costly public health crisis with a price tag of $14.2 billion, and it is the leading cause of preventable death in the postpartum period. And less than 40 days ago, we heard about a mother jumping out of her second-story home. Women are still not getting the right care. Mammha is the first complete virtual maternal mental health care accessible in one step. How does Mammha work? Physicians initiate screens using a Mammha QR code. Patients take the screen on their phone. Those results return immediately back to that doctor with talking points. And if positive, Mammha provides immediate follow-up, which means no woman slipping through any gap 100% of the time. Mammha takes care of everything after a positive screen. Once we catch a woman, we can connect her with ongoing support, check-ins, Mammha telehealth therapy, group therapy, support groups, medication management. Additionally, women are getting these supportive automatic text messages that are based in CBT and mindfulness techniques. And we have different tracks for parents with babies in the NICU, for fathers, and messages for parents who have experienced a perinatal loss. Finally, there's a solution for doctors where they don't need to hand her an outdated referral list and cross their fingers hoping she gets into treatment. They can also bill for screening reimbursement, and they can negotiate higher reimbursement contracts with payers for giving value-based maternal mental health care. And finally, women don't have to cold call and be told there's a 3-month wait or they don't take their insurance. We have found in the past 2 years that with Mammha, women are 5 times more likely to engage in care. And what does that mean? It means women getting better faster. And for physicians, we increased their routine screening by 40%. And now they've even added screening women in the pregnancy period. We've increased that by 80%. So before they were only doing it in the postpartum. What makes Mammha so special, besides taking that disease burden off of women and the follow-up care off of the physician's plate, is we know that maternal mental health isn't a one-size-fits-all. Sometimes medicine isn't the only answer. Sometimes a group isn't appropriate. And sometimes therapy, there are other ways to feel better besides just therapy. We know that a woman's treatment plan is as unique as her own motherhood journey. And the reason we know this is because we've lived it. We're also built on access, which means care for every woman, not just some women, every woman. Our business plan has us billing insurance for the care we provide, which includes our specialized care coordination, therapy, group therapy, medication management, and we also have unique screen subscriptions that organizations like the March of Dimes pays for. Since starting almost 2 years ago, we have done over 2,500 screens, and we have had over 500 referrals. 450 of those have been in the past year. And that's come from 2 states and Washington, D.C. We're adding 50 more screener users in March, as we are now working with the state of Maine and the March of Dimes. Can you imagine what we could do if we had 1,000 more physician screeners, or if we had a direct to consumer pathway available to women so they could access this care without needing their physicians? We are seeking $1 million seed investment to help us expand our system solution to create the new gold standard of care, so that we can close these critical maternal mental health care gaps, because no child deserves to grow up without a mother, for something that is treatable and preventable. Thank you so much.
Thank you so much, Maureen, for sharing. Really quickly in the Q&A time that we have, tell us about the competitive landscape for the platform.
So I'll tell you that right now there are so many companies entering into this space, but they are only trying to do a piece of the solution. So you have people trying to just do the medication part. Some are trying to do it for all women, but this is a really specialized group, a time period for women, this maternal time period. Also, some are just trying to do the downstream, so just the treatment part, but they're missing that we're here to disrupt the whole ecosystem of maternal mental health care, which means you have to include those physicians and create a solution for them, and also incentivize them to be able to provide this care for women. So we are the whole system solution approach for this.
You mentioned your partnership with the March of Dimes, and I'm just kind of curious, thinking about traction, how significant is that partnership for you?
You know, this is like such a trusted giant in this space, and they are so excited to roll out Mammha in this 3 NICUs in Virginia. And their goal, they've told us, is to roll it out to 70 other NICUs across the country. They know that this is a huge issue for women, and so we're just honored to partner with them, that they believe in what we're doing and that we can work together to close the gap for parents and with babies in the NICU.
Okay, and in 60 seconds, a question from the Q&A. Can you clarify on screening, what is Mammha screening for?
We are screening for depression and anxiety and also suicidality. So we use validated screens, the EPDS or the PHQ-9.